Welcome back, everyone, to Soda City Live. Okay, so do you have smoker's lines? You know, those little lines around your mouth that become more prominent as we age? But wait, you say you have those smoker lines, but you never smoked. Dr. Smythe Rich is a facial plastic surgeon in downtown Columbia, and Dr. Kayla Humanansky, I always have to get a running start for that name. She's also a plastic surgeon. So glad to have you guys with us. So we're not talking just about cigarettes that create those lines. We're talking about, I hear people say, like, don't drink out of a straw because you're forcing your mouth to do this. But I'm thinking, hey, the woman in the church choir who's singing like that, that's going to do that to the lips. Why does it happen?
You are in the church choir. So
I'm worried about my lips, my mouth.
It's supposed to close and to keep us from drooling and keep things in. And people have a stroke and you see what happens. So that muscle is very useful to like a sphincter.
Right.
But with increasing age and dryness of the skin and loss of volume. So these lines are multifactorial. It's not just cigarettes, and I think the straw thing is made up.
Yeah.
But we tend to look at problems, and I'm not going to really call it a problem. It's just sort of nice to look a little younger. But we look at it through the goggles of our favorite tools. And so many people now, 2022, they think filler, because that's just their bullet in their gun, and it's readily available. But there are other things that work better, a little more involved, and they're older. We might discuss some of those.
We will. In a few minutes, in fact, you're going to do a demonstration on a patient in the other studio, and we're going to show you one of the options. We want to talk about ways that you can correct that area. But first, is there anything we can do naturally to prevent that from happening, Dr. H., or is it just going to happen no matter what?
I think it's just going to happen. One thing to do is to try to take care of your skin. So the skin overlying it, you want to wear sunscreen and things like that. You don't want your skin to dry out and get leathery, because then those wrinkles look deeper and they're harder to correct.
How much does nutrition play a factor?
If you're hydrated, your wrinkles look
better,
less prominent.
Okay. Drink up, everybody. All right, so I want to go over some options that are on the market now that work and some that don't, and then we're going to look at the before and after pictures. So rattle off some of the options that are out there that you like first.
One of my favorites is just doing a little bit of Botox to sort of soften that muscle. You can still eat and drink and do all of your normal everyday things, but it just doesn't allow you to make those vertical wrinkles as strongly. And so hopefully that they don't get deeper over time.
But do you go around like this?
No, not at all.
No. That's the only thing I think some people are worried about with that. What's another option to fill that area?
Well, the ones that most people are ready, but that's an elegant option. It's a dynamic line. They don't go this way, they go that way. So if you put a few units, you're going to have a nice effect. Fillers have been around since 2004, and they really changed our landscape, the ability to add something safe that dissolves. And these fillers can be removed, if someone is overcorrected. Most of us think if you get fillers, your lip's going to be blown up and overcorrected, and usually that's because the upper lip is overdone. And so, but the filler's placed, and it might last about a year, and just want to realize the lower lip needs to be bigger.
And we're going to see some of the other options as we look at the pictures in a second, but before we hit those, what would you say does not work and you would recommend our viewers not do?
Well, we have unsafe things that and I'm a little older, so silicone was used and still is used in certain areas. And it looks beautiful, but that's a point in time. Then the face ages and the lip ages, silicone is still there. And there's problems with granulomas, or little bumps that can form in patients in my past have had 20 and 30 operations to remove them, where their lip became non-functional. So I think I would stay away from that. Implants in some people's hands can look okay, but I usually can spot them. And it does feel like battery cable in there sometimes. So we don't have the best answer, but our answers are less bad now.
Right. That's a good, if you're going to face it, get the better option. Let's go through some of the before and after pictures. We're going to pull up a lift lip before and after. This is patient number 1, and we're just going to show the before and the after. So what did you do on this treatment of this patient?
So not everyone is born attractive, as our staff here is, with a short upper lip and visible teeth, and it's sort of a walking around smile. And so with age, this distance from the nose to the chin gets closer together. Your bite changes and the lip tends to come down. So the lip lift has been around for about 50 years. You remove skin underneath the nose under local anesthesia. And afterwards you see a shortened distance from the nose to the upper lip. And it's a little attractive. So
Okay.
there's the before.
Yeah, can we hit the after, guys? Okay, we've gone into another one. Fat grafting before and after. We're going to look at these shots. Go ahead. What is fat grafting?
Fat grafting is a nice alternative to filler. It's done in stages, but you're using your body's own fat. So it's still done under local anesthesia. It's a small area of liposuction. We process that fat or micronize it to make it very small. So you don't get lumps or bumps, and then we inject it into the lips or other parts of the face for facial aging.
And then what about the next video, lip and face lift? These are the before and afters as well. So this one would be obviously a little more extreme.
Well, this patient, we did work on the the neck and the jowl area doing a facelift, but more specifically, this area from the nose to the mouth had been ignored, and people would have all this tight and smooth, and this upper lip got long, and the lower lip will come down as you lose jaw, and you're looking at lower teeth and not upper teeth. So removing a little skin underneath, you see your little red incision at 4 weeks, and then at the same time, we sanded or did dermabrasion, sometimes laser, to the skin. You injure that skin, and it's like sanding, the wrinkles away.
Right. I wanted to show that to you viewers, but they said no upstairs. Because it shows a little blood, which you would expect because you are sanding it. But the healing time on that, because it was amazing the difference I saw in that last woman. What's the healing time on that?
So it's kind of a wound like an abrasion, and it's about 7 to 10 days. On the subject of resurfacing the skin, wrinkles and other areas, there are no free lunches. So things that you get over very quickly, you got to do several times, don't really offer a great deal of change. But things that date back into the 60s and later 70s, dermabrasion, deep chemical peels, then later laser resurfacing. I was right here with one of your colleagues in '96 when the lasers came to South Carolina. And then you got into that 10-day, 2-week period, but you had great fruit for that.
Right.
So a lot of people are hesitant to take that time.
All right, so we're going to go to a commercial break here in a second, and then we're going to go over to our next Studio A, and you're going to have one of your patients. And what will you be doing on her today, live on TV, by the way?
Well, we're going to slowly numb this area, which some offices do, some don't. It doesn't really matter. It's a little more comfortable. And then we'll take a syringe of filler, Juvederm and Restylane. We're going to use some Juvederm back there for her. And we're going to edge the lips because they become flat. Hers aren't terrible, but she's got a very pretty lip. And we're going to edge the lip with a little bit of filler. And it can swell a little bit. It'll look overcorrected and then settle down. And about a week later, they insult my manhood. And they say, I thought you were going to put some in there. But we want to always undercorrect and keep these ratios of the lower lip has to be about 1/3 bigger.
Okay, so you mentioned, Dr. Humanensky, about the Botox injections. How long, if somebody chooses that option, how long does that last?
Botox generally lasts about 3 months, so it does need to be repeated.
Repeated, and the lines would eventually show up again just like before?
Correct.
Okay, and the other options last how long?
Well, the filler lasts about a year. Many times you do both. I mean, these wrinkles can be recalcitrant. They're just difficult, and and some people get tired of these temporary measures. And we offer. I mean, fat grafting is about the most beautiful thing, but it's a small procedure, and someone that's got a little comfort level in handling it. And then resurfacing is for wrinkles. But volume is a part of it. Dry skin is a part of it. The muscles part of it. It's multifactorial. So we look and see, what's the right thing to do, and then but then everybody doesn't want to do the right thing.
Right.
I know the right thing to eat, and I don't always eat the right thing.
Sure.
So we meet them where they are. Sometimes do something easy rather than the best thing.
Right, the hospital calling you. I hear your pager thing going off there. Okay, so we're going to go to Studio A. The doctors are going to head over there with me as a patient awaits her treatment in a live demonstration. That's next on Soda City Live. Stay with us.